You spend years perfecting clinical technique, but keeping a podiatry practice open requires a different system of operations. Scheduling patients, verifying insurance, and managing billing workflows create a continuous administrative load. For many practice owners, managing that load has triggered an exhausting cycle. You hire a front office administrator, spend weeks training them, and then they leave for another job. You cover the gaps, morale drops, and the cycle repeats. This bar chart breaks down recruitment difficulty across healthcare roles based on MGMA data. Nearly 47% of practice leaders rank medical assistants as the hardest position to fill, a rate almost triple the difficulty of recruiting nurses. The cause of this shortage comes down to basic market competition. Independent mid-sized podiatry practices are pulling from the exact same labor pool as massive hospital systems and urgent care networks, putting local clinics at a severe disadvantage. The raw data suggests the inability to keep a front desk staffed has become a structural failure. The traditional model of hiring local, in-house support for independent clinics is breaking down. Practice owners often overlook the full weight of the crisis because they focus on base salaries, missing the actual operational expenses of employment. Look at this waterfall chart detailing the true cost of an administrative hire. The median base salary for a medical assistant sits at $44,200. Add payroll taxes, health benefits, and overhead, and that single in-house hire costs over $60,800 a year. That investment vanishes upon resignation, costing up to 200% of their pay to replace every 12 to 18 months. Between those periods of turnover, the practice absorbs the cost of undertrained replacements, making workflow errors. Insurance verification calls are missed, patient callbacks pile up, and claim denials slip through. Eventually, the physicians have to step in to keep the office moving. According to the Medscape Physician Compensation Report, doctors are now spending an average of 15.6 hours a week strictly on non-clinical administrative duties. That is nearly 2 full clinical days lost every week. In a specialty where billable procedure time drives your revenue, sacrificing your clinical hours to fix scheduling errors translates into a massive financial bleed. A growing number of clinics are solving this by shifting their administrative workflows to a dedicated remote staffing partner like Staffingly. Staffingly provides a permanent, integrated layer of virtual medical assistants, pre-trained in specialty-specific healthcare operations. Podiatric billing is notoriously complex. Staff handling these claims must understand strict Medicare documentation rules and exactly when to apply Q modifiers, the specific billing codes required to justify routine foot care reimbursement. Staffingly's AI routing system handles this complexity automatically. Incoming tasks, like foot surgery authorizations or diabetic care verifications, are routed to the best-equipped specialist. Real-time SLA monitoring tracks turnaround times, preventing routine paperwork from building into a backlog. For patient-facing tasks, AI voice neutralization technology ensures every phone call sounds perfectly clear and professional, regardless of where your virtual assistant is physically located. By combining specialized human knowledge with intelligent task routing, this system directly targets and eliminates the administrative errors that cause podiatry claim denials. Let's compare the two models directly to see how this impacts a clinic's bottom line. An in-house administrative employee costs $60,800 annually. A Staffingly virtual medical assistant costs just $21,600, with zero physical overhead. This delivers an annual net savings of $39,200 per position, a 64% cost reduction. The remote virtual model repairs a clinic's profit margins by entirely removing the overhead penalty of local employment. Naturally, migrating sensitive healthcare data out of a physical office requires rigorous protection. This layout displays the compliance standards maintained by Staffingly's elite security infrastructure, including HIPAA, SOC 2 Type 2, ISO 27001, and HIT-REST certifications. The virtual team integrates with over 50 different electronic health record systems. Access is strictly managed through encrypted VPN connections, ensuring that no protected health information, or PHI, is ever stored on local devices. Deployment is fast. The initial go-live window takes just 48 to 72 hours, with most practices achieving full operational capacity with their dedicated podiatry team in under 2 weeks. What traditionally takes months of frustrating recruitment, interviewing, and training can now be securely executed and optimized in a matter of days. Standardized protocols and specialized remote support take those 15.6 lost administrative hours and hand them back to the physician. Escaping the local staffing spiral yields a highly efficient practice and a 64% reduction in structural costs. To initiate a 30-day risk-free trial with no long-term contract required, visit staffingly.com/demo or call their toll-free number today. Surviving as a modern podiatry practice requires moving past the local labor shortage and evolving your core operational model.